this video, we're going to be doing goniometry of shoulder flexion and extension. So when we're doing goniometry of the shoulder, we're going to begin first by doing flexion. So we're going to have our patient in the supine position. Another important thing to do when we're doing goniometry is that we want our spine to be aligned. So we're going to ask our patients to bring their knees up. That way our lumbar spine isn't as arched and it's coming more even with the rest of the vertebral column. So before we do the flexion of the shoulder, we want to orient ourselves a little bit with the goniometer. So to begin with is the fulcrum, which is going to be the center point of the goniometer, and that's going to be aligned with the greater tubercle of the humerus. An easy way to find that is to follow the spine of the scapula across. You'll feel the acromion, it'll drop off a little bit, and then right there will be the greater tubercle. The stationary arm, or the proximal arm, whichever you choose to call it, that's going to be in line with the midline of the thorax, which is also going to be usually parallel with the floor. And lastly is going to be our distal arm, or our moving arm, which will follow the arm through the range of motion and will be in line with midline of the humerus, or we also can use the lateral epicondyle for reference. Alright, so before we begin with the actual goniometer, we do want to bring our patient passively through the full range of motion. Alright, so some things to watch for when we're doing this are to look at the scapula and make sure that it's not doing any type of posterior tilt or upward rotation. And when we bring Tyler through the range here, at about that point we see his scapula start to lift up, and we don't want to push too far past that. When we're also doing the passive range of motion, we're getting a feel for the end of the joint, what that end feel is going to feel like, which should be firm, and that's what his feels like. And we're also going to be estimating approximately what the measurement will be. So we're going to find our landmarks now. I'm going to follow the spine to the acromion, and we have the lateral aspect of the greater tubercle. And if you were to look through, that would be about the center point of the glenoid fossa, which is where the joint motion occurs around. Alright, so with the goniometer, it is a little bit tricky because this point does disappear when we do shoulder flexion, because the axle will get in the way and that point disappears. So we do want to align our goniometer first. That way there, we have that point of reference to begin with. Alright. And when we're measuring in anything with goniometry, we do want to be at the eye level with the goniometer. That way there we're getting an accurate reading and we're seeing our landmarks best. Alright, so yeah, hold it there. We're going to bring our patient through the range of motion. And right about there is where his scapula starts tilting up. We're feeling for the lateral epicondyle, right there, keeping our goniometer in line with it. Alright, and we can relax our patient back. And as you can see on the goniometer here, our patient's reaching at about 175 degrees, which is just shy of the normal range of 180. So that's shoulder flexion. Alright, now we're going to be doing shoulder extension. So for shoulder extension, we're going to have our patient lying in prone. So could you turn around for me, please, onto your belly? Great. Alright, so with shoulder extension, just like flexion, we want our arm in the neutral position. So bringing with it our palm towards our body, or thumb up, or in this case, thumb towards the floor. And we're going to be bringing our patient extended like that. The landmarks for this are exactly the same. The fulcrum is again at the greater tubercle. Our stationary arm is again in midline with the thorax. And our distal moving arm is going to be in line with the lateral epicondyle. We're going to start with some passive range of motion to get that end feel, and that should also be firm, just like in shoulder flexion. And we're also going to estimate about how many degrees we're seeing of motion, and the normal would be 0 to 60 degrees. All right, so we're going to bring him up. All right, and with this we are watching again for the scapular tilt, this time anterior tilt. All right, so now we're going to get everything aligned, and unlike shoulder flexion, our landmark does stay about the same versus disappearing like it did with the flexion. All right, so again, we're going to go along the midline, the spine of the scapula to the acromion. It's going to drop off, and we have the greater tubercle of the humerus. All right, so we can align our fulcrum right there. We're going to bring our patient through the motion. All right, and we can realign at this point. Feeling for the lateral epicondyle. Just up here, we're going to readjust. All right, and we can relax. And so our patient today is getting at about 47 degrees of shoulder extension, still a little shy of 60, but certainly okay. And that's shoulder extension.
Is that a full range of motion, Kiki?